Good afternoon, everyone. Today, we're going to talk about something crucial for many of us, especially those managing heart conditions, the vital role of water pills or diuretics, and their often overlooked connection to our muscle health. Our focus is on understanding this relationship and why proactive management is absolutely essential to stay strong and healthy. Diuretics are a cornerstone of cardiovascular medicine. For many years, they've been indispensable for treating conditions like high blood pressure and heart failure. Simply put, they work by helping your kidneys flush out extra salt and water, which reduces fluid buildup in your body and helps lower blood pressure. For heart failure patients, they are critical for relieving symptoms like swelling and breathlessness. However, despite their clear benefits, the relationship between these medications and your muscle health is more complex than many realize, and that's what we'll explore today. Not all water pills are the same. There are different classes, each with a unique role. Thiazide-type diuretics are commonly used for high blood pressure. By effectively managing blood pressure, they actually help prevent the development of heart failure, and in doing so, they indirectly protect you from the severe muscle loss that often comes with advanced heart failure. Then we have loop diuretics, which are the most powerful. These are usually reserved for heart failure patients experiencing significant fluid buildup. They work quickly to relieve symptoms like swelling and shortness of breath, making a huge difference in comfort and preventing hospital stays. Finally, potassium-sparing diuretics are often added for heart failure. They're special because they not only help manage fluid and potassium levels, but they also counteract harmful chemical signals in your body that can worsen heart failure and even contribute to muscle loss. In fact, these can actually help improve how your muscles function over time. Now, let's talk about muscle loss, also known as sarcopenia. It's a common, yet often overlooked, problem in chronic conditions, and it's particularly pronounced in heart disease. In severe cases of advanced heart failure, we see something called cardiac cachexia, which is a profound, whole-body muscle and weight loss. This isn't just about feeling weak. Muscle loss in heart failure is driven by a complex mix of factors: chronic inflammation, imbalances in body hormones, reduced activity because of fatigue, poor nutrition, and issues with how your body uses energy. This isn't just a symptom, it significantly increases your risk of falls, hospitalizations, and negatively impacts your overall health and quality of life. So, how do diuretics fit into this muscle loss picture? It's not a simple answer. For thiazide-type diuretics used in high blood pressure, their primary, muscle protective, role is actually by preventing you from developing heart failure in the first place, thus avoiding the severe muscle loss associated with that condition. However, if not carefully managed, these can cause localized issues like muscle cramps or weakness from electrolyte imbalances, specifically low potassium or magnesium. Now, for loop diuretics, used heavily in heart failure, it's more nuanced. They are absolutely vital for managing dangerous fluid buildup. But, there's a growing concern based on emerging research that suggests a more direct link between long-term, high-dose loop diuretic use and muscle wasting in heart failure patients. Scientists are actively investigating how this happens, with theories pointing to effects on how muscle cells produce energy or how they build and repair themselves. This highlights a critical balancing act for your doctors, removing dangerous fluid while also working to preserve your muscle mass. Given this complex relationship, proactive management of your diuretic use is non-negotiable. This means a continuous effort, primarily by your healthcare team, but with your active participation. It starts with meticulous monitoring. Regular blood tests are crucial to check your electrolytes, like potassium, sodium, and magnesium, as well as kidney function. These tests are frequent initially, then become less frequent once your condition is stable. Your doctor will also aim for the lowest effective dose of your diuretic. This is a careful balancing act. You'll need to know the signs of both underdiuresis, not enough fluid removal, leading to worsening breathlessness or swelling, and overdiuresis, too much fluid removal, which can cause dehydration, dizziness, rapid weight loss, or even muscle cramps. Finally, if any electrolyte imbalances are detected, your doctor will proactively manage them, often with supplements, to prevent those muscle issues. Your active involvement is a powerful part of proactive management. First, educate yourself, truly understand your medications, their purpose, and what symptoms to watch for. A key habit for heart patients is daily weight monitoring. Report any sudden changes to your doctor, as this helps them adjust your diuretic dose. Pay attention to dietary advice, especially sodium restriction and appropriate potassium intake. Your doctor or a dietitian can guide you on this. Beyond medication, a holistic approach to muscle health is paramount. This includes optimized nutrition, particularly ensuring you get enough protein, which is essential for building and repairing muscles. Also, embrace tailored exercise programs. Resistance or strength training is incredibly effective for muscle health, and if you have heart failure, a cardiac rehabilitation program can provide safe, supervised exercise. Finally, managing any other health conditions you might have also supports your overall muscle health and well-being. It's important to understand the risks if diuretic use isn't properly managed. Unmanaged electrolyte imbalances can lead to persistent muscle weakness, cramps, and fatigue, which severely impacts your mobility and significantly increases your risk of falls. In heart failure patients, poor diuretic management, including potential direct muscle wasting from loop diuretics, can worsen the already severe muscle loss characteristic of their disease, leading to a faster decline in physical function. This can also increase your overall risk of other health issues requiring more medical or surgical interventions. Ultimately, the cumulative effect of muscle loss and related complications profoundly diminishes your independence and overall quality of life, making it harder to enjoy everyday activities and hobbies. To summarize, diuretics are incredibly vital tools in managing and preventing cardiovascular disease. We've learned that different types have different implications for your muscle health. While thiazide-type diuretics indirectly protect against severe muscle loss by preventing heart failure, loop diuretics, despite being essential for managing fluid, have an emerging potential to directly contribute to muscle wasting in heart failure patients. This nuanced understanding underscores that diuretics must be used with precision and careful monitoring. The goal isn't just about managing blood pressure or fluid, it's crucially about preserving your vital muscle mass, preventing debilitating complications, and ultimately securing a better quality of life for you. You are an incredibly important part of your healthcare team. Don't hesitate to ask your doctor questions about your medications, your blood test results, and what you can do to protect your muscles and overall health. Specifically, you might ask your doctor about the potential impact of your loop diuretic on muscle health and what strategies can be put in place to monitor and minimize any muscle loss. By working together, you can ensure your water pills are truly helping you live your best and strongest life.